Non-invasive ventilation masks are the #1 source for medical device-related pressure injuries in our facility. Skin should be checked under the non-invasive device at least twice per shift. In order to do this, collaborate with your respiratory therapist to minimize interruption in support. Remove the mask entirely. Peel back any protective dressing you may have in place in order to look and touch the skin to assess for temperature, integrity, and blanchability. Check the back of the head where the BiPAP straps sit for skin integrity as well. If possible, have the patient sit forward for ease of visualizing the occiput in the neck. Replace the protective dressings and replace the mask when you complete your assessment.